Hello, I'm Diana Keogh, Editor-in-Chief of Sharewik.com. Today we're talking to Dr. Marcelo Gomez, who is a specialist in vascular medicine and thrombosis at the Cleveland Clinic. Dr. Gomez is going to be talking to us today about deep vein thrombosis, also known as DVT. Dr. Gomez has agreed to take questions from our members that have come in over the internet. Dr. Gomez, the first question comes from Colleen from Pittsburgh.
Dr. Gomez, my mother had DVT. Is this condition hereditary?
No, DVT, or deep vein thrombosis, blood clots in the veins of the legs, the cause of the blood clot may or may not be hereditary. Most patients do not have a hereditary cause for the blood clots. Some patients will have some genetic conditions in clotting proteins, and that may predispose them to blood clots.
Dr. Gomez, this question came in on our Twitter account. I just had hip replacement surgery and my doctor prescribed a blood thinner to avoid a DVT. How long do I need to stay on these meds?
If you just had hip replacement surgery and if you did not have a blood clot, there are some guidelines in North America about how to prevent clots in that situation. And what guidelines state is that you should be on a small dose of a blood thinner. It's usually an injectable blood thinner, so an injection under the skin, for up to 5 weeks after surgery. Obviously, the other measures to prevent blood clot would be going through physical therapy and making sure you get back into walking as normally as you can as soon as possible. But in addition to physical therapy and being able to walk and bear weight on your leg, the preventive measures with an injectable blood thinner is incredibly important. It is currently recommended by guidelines.
Dr. Gomez, what are some common causes of DVT?
Okay, so the most common causes of DVT is the patient who is admitted to the hospital recovering from major surgery or who is critically ill, admitted in an intensive care unit. So it's acute illness, hospitalization, being in bed, not moving around, and especially if the person is very sick. So these are by far the most common causes of blood clots. Also people who have had injuries like leg fractures while skiing or with an accident and they have a cast in their legs, and again because they have a cast in their legs and they may not be fully mobile, there's a risk for DVT as well. So those are by far the most common risks.
And this question was posted on our Facebook page. I'm about to take an international flight and I know doctors suggest to get up and move around every so often to prevent DVT. What symptoms should I be aware of if DVT were to be a concern?
The symptoms would be symptoms related to the leg. It's usually calf pain, calf cramping, swelling. Now, these are very common symptoms. If we ask, people leaving an airplane after long-haul flights, a lot of people have these types of symptoms. The symptoms, though, usually do not happen during the flight itself. They happen within 24 hours after you've arrived to your destination. But you have to look for calf pain, leg pain, ankle swelling, leg swelling. Those would be the signs, the warning signs of a DVT.
Dr. Gomez, thank you so much for joining us here on Sharewik.com. This has been great information. If you'd like more on the topic of deep vein thrombosis or DVT, please go to our website at www.sharewik.com.